Maternal diet. Adequate nutrition is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which include dark green leafy vegetables, milk, and yogurt. Drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. Gradually increase your daily activities until you are back to your normal routine. Rest frequently. No lifting, pushing, or pulling for the first 2 to 6 weeks or as instructed by your physician. Do not drive until you are released by your physician. Your breasts and nipples may have changed and or grown in size during your pregnancy. Wear a well-fitted, supportive bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. Leaking may occur for several weeks to months. You may apply ice packs between feedings to ease discomfort. If you're not breastfeeding, wear a well-fitted, supportive bra for at least 3 to 4 days following delivery. Refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement. Apply cold compresses in the form of a frozen wet towel, cold packs, or ice packs for 15 minutes at a time every hour as needed. To prevent tissue injury, do not apply cold directly to the bare skin. Do not massage or apply heat to the breast. Breastfeeding tips. Your baby's mouth should form a tight seal. The lip should be against the areola, not the nipple. If the baby is sucking incorrectly, slide a finger between your baby's lips and your breast to break the suction gently. Reposition and try again. How long should you nurse? As long as your baby wants, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, though not for very long. It is important for the health of your breast to have your infant feed from both breasts every feeding. Good signs of nursing include hearing your baby swallow without a clicking sound, seeing movement above the baby's ears, and not seeing dimples in your baby's cheek. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it may mean the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. Hygiene. Wash your hands frequently as you are caring for yourself. To prevent infection, always wipe front to back after going to the toilet and clean your bottom with warm tap water using the peri bottle after you urinate or have a bowel movement. It is important you change your pad frequently. Bleeding. Vaginal flow will decrease in an amount from bright red to pinkish or brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. Avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to your normal pattern. Increase fluid and fiber in your diet. Discuss birth control options with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse. Nothing should go into the vagina for the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman feels physically and emotionally ready. Warning signs to report to your healthcare provider immediately. Pain, redness, warmth, swelling, draining, or foul-smelling discharge from the incision or the incision begins to open. Discharge from the vagina that has a bad odor. Severe headache or blurred vision and visual changes. Temperature over 100.4 or you feel cold, feverish, or have chills. Thoughts of harming yourself or your baby. Pain or burning sensation, redness, warmth, or swelling in the legs. Breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms. Sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness, or faintness, crying spells or mood swings that feel out of control, unable to empty your bladder or urination that is painful, difficult, or too frequent, difficulty having a bowel movement. To report domestic violence or abuse, call 1-800-96-ABUSE. Infant safety for sleep. Place your infant on his or her back to sleep. Use sleep clothing such as one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress in a safety-approved crib covered by a fitted sheet. Car seats and other seating devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parents, but not in the same bed. Avoid covering the infant's head or overheating. For bulb syringe, keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe well with warm, soapy water after each use and allow to air dry. Wash hands prior to handling the neonate. All infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. The use of outdoor announcements is not recommended to announce the birth because they can call attention to the presence of a new infant at home. Question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marked to reduce the risk of SIDS. Behavior. Crying is a normal response for your infant to cry. The most likely causes for crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. Calming techniques include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend. Infants require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feedings. You should place your baby on his or her tummy each day for supervised tummy time. This will help strengthen his or her neck and abdomen. Diet for breastfeeding. Your infant should breastfeed 8 to 10 times a day per infant cues. Positioning. Be sure to hold your infant close to you while feeding. Your infant needs to be cuddled and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. If you're formula feeding, your neonate is receiving a Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses feedings, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. Be sure to hold your infant close to you while feeding. Your infants need to be cuddled. Never prop your infant's bottle to feed. Burping. Infants need to be burped every half ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. Newborn characteristics include the newborn rash. It is normal for your infant to develop a rash on his or her skin. It appears with small red circular areas with a white dot in the middle. This does not require treatment and will generally resolve in the first week of life. Avoid lotions, powders, and perfumed soaps. Milia are pearly white bumps, usually on the face, especially in the nose. They will disappear within the first few weeks of life. Jaundice is a common occurrence in newborns. Your infant may appear to have a yellow coloring to his or her skin. It will start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours, you need to call the healthcare provider immediately. When bathing your infant, you will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water, gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant type soap may be used on your infant's body. Cord care. Keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin when diaper changes and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within 2 weeks of life. For wet and dirty diapers, 1 to 2 wet diapers are normal for the first day or 2 of life. Then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. Genitalia for female, always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. It is normal for baby girls to have a white or pinkish discharge. The secretions are normal and will gradually disappear. For an uncircumcised male, always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. For a circumcised male, always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. Vaseline gauze is applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially and then will change to have a yellowish sticky film. This is very normal. If you see any bright red bleeding or green drainage, you should contact your healthcare provider. The plastic ring method of circumcision does not require dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red or bleeding, or a green discharge drainage, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad in plain water. Dress your infant as you would dress yourself. Avoid overdressing your infant. Too much clothing and too many blankets may cause your baby to become overheated. An infant should receive all recommended vaccinations.